Hello guys, my name is Dr. Ajita Dubey and today I'm going to be discussing a case with you that I saw at my dermatology OPD. It is a really nice case and let's hope we can learn something over here. Alright, so this child, a 9-year-old child, he presented to me with with complaint of these lesions, okay, and these lesions involved the neck region, alright. His face was affected and also the upper chest. This is as far as the location of the lesions is concerned, and there was history of an upper respiratory tract infection around 4 to 5 days back, right? So the mother was very concerned, particularly because according to the mother there was this tendency of the lesions to spread. All right, she said that these lesions were increasing. First they were a few in number and now there were a lot involving his entire neck, which is what was scary for the mother. So let's see if there's something to be that scared of. I would like you to focus on this lesion if you can. All right, and let's describe it because it's a very classical case. That is why I liked it so much. It's a dermatology spotter which you might even get in your final MBBS examinations. So if I describe the lesion, I can say it is kind of dome shaped, right? Elevated dome shaped. You can describe the color of the lesion as pearly white or even skin colored if you would like to use that term instead, right? And you can see that there is, if you focus on this exact part over here, right, there is a central indentation, right? Central dip indentation, or something that we use a very fancy, very cute term for. It is umbilication, like your umbilicus, right? Okay, so what is this? If you have not guessed it by the description even by now, guys, this is molluscum contagiosum, right? Molluscum contagiosum. It is caused by molluscum contagiosum virus, type 1 generally in children, type 2 in adults. Type 1, which is in children, generally tends to involve the skin of the face, okay, and neck region, the upper region of your body. And type 2, which is generally seen in the adults, generally tends to involve your genitals. All right, so what exactly is the incubation period? Around say weeks to months, okay, so 2 weeks to 6 months. All right, and it can have history of an upper respiratory tract infection associated with it. So what exactly is a very nice thing over here, which the mother gave you history of, which is that the lesions tend to spread. What exactly it is known as? What exactly is it known as? So this is the phenomenon of pseudocobnerization. Cobner, I'm not sure of the spelling. Cobnerization, right? So what exactly is cobnerization? Cobnerization is a phenomenon that is seen by seen in certain lesions of dermatology, seen in certain conditions of dermatology, wherein the lesions of a particular disease tend to spread along the lines of trauma, right? But this is known as pseudocobnerization because it's not due to the lesion spreading. It is due to a condition which we call auto-inoculation. When you are scratching along that particular line, then your lesion is tending to spread, the virus is tending to spread along that line, and that is why you see that there are similar lesions along the line where you are scratching. But it is not because of cobnerization, it's because of auto-inoculation. All right, and what is molluscum contagiosum exactly? Molluscum contagiosum is basically a viral infection of your epidermal keratinocytes, and it is generally self-resolving, so you don't really need a treatment per se, right? It is self-resolving, but you can go for treatment options like trichloroacetic acid, or you can go for KOH, right, potassium hydroxide, and if that does not help, you can even go for curettage or cryotherapy. So yeah, that's about the disease, and I hope you like this. This is a small like OPD case that I shared with you. I hope you enjoyed. Take care. Bye-bye.